Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And we're here at the Vive 2023 conference, and our guest is Kathy Ford, Chief Product and Strategy Officer at Ronin. Welcome, Kathy.
Hi, John. Thanks for having me.
Yeah, excited for today's discussion, but tell us a little bit about yourself and Ronin.
Sure. So I have been in healthcare for over 30 years now, really delivering solutions across a continuum, regulated and non-regulated in about 50 different countries.
Wow.
Yes. So at this stage, and I've done all sorts of things from sales to marketing, but most of those 30 years has been innovating in healthcare. And I'm especially passionate about bringing solutions that truly do make a difference in healthcare. We have many things to solve, of course, and so which is why Project Ronin is really near and dear to my heart, and such a great focus to be a part of.
Yeah, that's awesome. Well, I mean, we're here at Vive, one of the hottest, most annoying topics, let's be honest, to an organization, is the workforce shortage. How can the healthcare organizations work strategically to address this workforce shortage?
Yeah, it really is a crisis, actually, that isn't going away. In fact, it's only worsening.
Yeah.
We certainly saw the effects of that with COVID, but we're nowhere near recovered. And again, in desperate need of ways to close this gap. And we look at it as technology is the key to that in order to address it. So you can't overnight sort of create new clinicians.
Yeah,
there is a cycle that goes with that. And so, how else can you solve this problem? What you need to do is take all the low-level tasks out of the hands of the clinicians so that they are focused on the most critical needs that really their expertise only can address, and leave the rest of it to technology.
Yeah, that makes a lot of sense. But I think what's interesting is how can healthcare organizations and provider organizations embrace technology, innovation, we have AI, automation to really ease that administrative burden on clinicians so that we don't lose more clinicians.
Yes. It's looking at what are the most painful problems in healthcare that need to be solved, and technology should focus there first, because what we know in healthcare is change is hard, and change is a burden, actually, even if it makes some things a little better. What technology, the best technology solutions essentially take away those pressures and make it easier for clinicians to engage with patients. And because now we know also patient care is moving out of the four walls, and we're treating patients where they live and meeting them where they are. And so you really want technology solutions that also are engaging, easy to use, and create that technical or virtual connection so the patient is engaged in their care, participating. The clinician can't do it by themselves, and so you really do need to bring that patient in and along, and that alone, that will reduce some burden. A lot of the burden that clinicians, especially in oncology, because cancer is such a brutal disease, they're really closely connected to their patients, and they want to be available 24/7. And oncology is one of those really unusual diseases where we actually have to make patients sicker to get them better. And so when that happens, of course, a whole bunch of adverse events typically occur as well as a part of that, which leave patients often confused, unsure whether it's expected. And so technology is a fantastic tool in order to help ease that patient's concerns, manage their expectations, deliver education, and keep them on a regular cadence, making sure that they're adhering to their medications and to their regimen and staying on course for treatment. That's one of the recipes for a better outcome scenario, and that also reduces the burden to a clinician.
I love that. I've never heard someone say change is a burden, because it is a burden until it solves the problem and improves other areas.
Yes.
So it's fascinating to think about. And we saw IBM Watson. It was the sexy thing on the block, the Jeopardy, everything like that. And it was an early clinical AI effort that kind of fell flat, to be frank, but what did we learn when it comes to the state of AI and in particular cancer care, since, Ronin focuses on that, and where are we now?
The IBM Watson and some other pursuits obviously was an interesting scenario, but it was also quite a while ago. And so it was honestly early days for machine learning and AI. And so some maturity was lacking, like machine learning ops is standard fare for any technology company. That did not exist then. So really the production element of what it takes to bring machine learning and AI into a commercial environment, into a clinical setting, and have it run as expected. Just the maturity of technology wasn't there, and IBM was not in a place to implement that. There was also from my perspective, what Ronin does is we enable the clinician to make the best decision at the point of care, leveraging data, system of intelligence, versus Watson sort of had these claims around um, giving decision recommendations. And that's we do not believe that AI is going to replace a clinician at all. What we want to do is leverage AI and machine learning to enable better decisions, more precise decisions at the point of care. But ultimately, the decision is made best by the clinician and not by a computer.
Yeah, I mean, it's really interesting the evolution as you talked about it, but talk to me about what are the benefits of using a clinical intelligence software like Ronin for patients and for oncologists?
What a lot of people don't realize is when a patient is diagnosed with cancer, their medical oncologist or their care team is really left with limited options as far as how to determine what the right treatment course is initially, and really even more than initially. And so, what is typically used is a standard guideline that is based on millions of patients, that's reviewed a couple times a year, changes very infrequently, but it's based on general patient population. It has absolutely zero relativity to the patient specificity or anything unique about that patient. And so a system like Ronin, and what Ronin does specifically is it puts cohort specific information in the hands of the clinician so that when they're looking at treatment decisions for the patient, they can understand patients like Mary, with who are similar in comorbidities and social determinants in hundreds of different unique data types, have had this sort of outcome. Patients like Mary that match have, and then with incoming, say, lab data value changes, have been at high risk for presenting to the emergency department. It's prediction and it's more patient precision that systems like Ronin, and what Ronin does really well, that we deliver that to clinicians. So they're not making general decisions about a patient, they're making something way more specific, which is where we need to get to because we're all very unique people. And it's why, and what we don't want to do is spend time trying first treatment line. Oh, well, that didn't work. 6, 8, 12 weeks later, we're going to try something else. We're going to try something else. That's problematic on a number of fronts. First and foremost, you are putting at risk, a survivorship outcome, of course, as time is passing. So time is the enemy, especially in cancer care. So the best treatment as fast as possible, that's Ronin's focus. Number two, when you are trying different treatments, treatment 1, treatment 2, treatment 3, treatment is expensive. It's incredibly expensive in oncology, especially. Drugs are 65% of the cost of care in oncology. So if you are sort of trial and erroring this for patients, you are also affecting their ability to pay and just the general cost of care. And so the more precise we can get as fast as possible, that's better for both patient and our economic system, which is in crisis, of course, in healthcare.
Sure. Well, I think what's interesting is hearing you talk about that precision. You really need AI to do that, right? So talk about how that's changing the game, changing the experience, and the key that AI is for these types of solutions.
There's so much data in healthcare that is unleveraged. However, the data is also unclean, uncorrelated, non-contextualized, and unique in every system, even though it may be referring to the same thing, said slightly differently, or used in a slightly different way. And so you actually have to use technology to make sure that everybody's talking about the same thing and that it's understood the same way. So when a patient complains about something, uh, are they feeling nauseated, or do they just have a question about nausea? So, and that's a very simple example, but when somebody's trying to interpret notes and try to understand what is really going on, it's what AI is doing is basically taking what clinicians are doing in spreadsheets. They're pulling all this information out and they're trying to basically do their own problem solving in the way that they were taught. And so what AI is doing is taking all of that really complex data, organizing it in a way that makes some sense of it, and then using it to then the model then is looking and saying, here's the trajectory of this information about the patient, because we all sort of wish for, but it really is a reality with the evolution of AI, and when it's done correctly, is we can get to prevention, and we can certainly get to a better prognosis faster. About 50% of almost all cancers are preventable.
Mm.
So how is it that cancer is still on the rise?
Right.
And we have, the U.S. happens to have a really high volume of cancer patients, within the world. And we're the most advanced nation in the world.
Sure.
And so, we're out of balance. So, we know healthcare is really risk adverse as it relates to technology, understandably so. However, now is the time, and especially in cancer, we cannot wait. It needs to be now. Not one person I've ever met is not affected by cancer in some way, whether personally or family and or friends.
Sure.
And so it's urgent. We have to leverage technology now. We have to use what it can do. And what it can do today, and what Ronin is doing today, is we're keeping patients out of the emergency department in avoidable scenarios. So sometimes patients still need to go.
Yeah, of course.
But if a clinician knows that they are elevating or escalating, then they can intervene and make an educated determination about what is best for that patient right there.
Nice.
And so that's where AI right now can have an immediate effect. And then as AI gets smarter, as we continue to validate what it means in our industry to be safe and ethical, then, and as we are ingesting more data into these models, then we can get to more patient-specific precision, and then get to the path to preventative.
Yeah, let's dive into that a little more, because I think it's great that, and then you're right, today we can do that, right? And it's great that AI can make an impact today. But where do you see as like the most promise? Is it for that personalization, and where do you kind of expect the field to evolve in the next, say, 5 to 10 years?
You know what doesn't exist today in healthcare, and that I've been in it for 30 years, I haven't seen it in any solutions, whether it's in cancer or not, are solutions that enable the clinician to factor in a patient's values, patient's interests. So especially in something like cancer, a cancer diagnosis, and especially later stage, oftentimes patients have their own personal desires about their care that are very non-care oriented. They are things like their lifestyle, or personal personal elements. Like, I wanna just be able to walk my daughter down the aisle. I just need to get there. That's my patient goal. And there are no tools that say, okay, tell me more. What can you tolerate? Do you need to work every day? Can you afford $10,000 a month? Those tools don't exist today. However, technology like AI and machine learning absolutely can put those tools in the hands of clinicians. And that's exactly where Ronin is focused. And that's exactly what is the future for our solution. And we'll take it outside of cancer as well. Cancer happens to be one of, if not the most complex disease to manage. It's very complicated, very complex, very expensive, and so we feel like how we're building out the solution really delivering significant value in oncology will enable us to then bring that into other chronic diseases like chronic kidney and CHF and others. But we look at, I mean, the patient's always in the center for us, of course. And the urgency, again, as I said, as far as getting it into the hands of clinicians as fast as possible. Our co-founders, part of the early vision for Ronin was, you know, why is it that only people that have, you know, either the financial wherewithal or the physical proximity to a place like MD Anderson get the best care?
Sure.
And, you know, what about everybody else? And why not everybody else? And
Right.
the way you do that is you use technology and you put that in the hands, you put the best tools so that clinicians anywhere in the world can make the best decision about that patient and with all the insights. So they know everything to consider and then they can make the best decision.
What a powerful idea. I literally never heard anyone say, have we incorporated patient preference into the AI and the decision making, which could be part of the care plan, right? If it's down the aisle, maybe I treat him a different way than I want to live as long as possible, which could be a different preference.
Yes.
What a fascinating idea.
Yes. I, you know, need to use my fingers every day. I cannot handle neuropathy.
Right.
So I need a different treatment type that will not
Sure.
prevent me from continuing to do what I've done for 30 years as a career.
Yeah. You know, we do this and doctors do this, right? I mean, I go to my sports medicine doctor, who I consider my primary care doctor, and he knows that I want to play sports, and he's going to treat me different than someone else who doesn't. Like, we should do that across all factors of care.
Exactly, right?
Not just because he's my friend.
Right. And why not have a tool that is using data to surface essentially
Yeah.
those
'Cause how
considerations?
does the doctor understand that if, you know, they don't have time to go through all that?
Exactly, they don't. And especially as it relates to treating an oncology patient, if you think about the mental burden that that doctor is going through when they're seeing you, they are looking at first, before they even see you, they need to understand your last labs and what are your values? Are any of them out of range compared to also then the labs before?
Sure.
What was the latest pathology? Have you had any imaging done? Have you reported any symptoms? Did you go to the emergency department? They are hunting this information down within the EHR. Did somebody make any notes? Is it in a clinical encounter? Is it in another encounter type? Where in the world? And it's literally a fishing expedition through their EHR, which is a system of record, but not really designed to deliver a hierarchical, you know, clinical experience by design for that. So what Ronin does is by lifting all that, and we are the hunters of all the data through the EHR. It sounds really simple, like we're just pulling it, but again, you have to contextualize it, clean it up,
Absolutely.
organize it, and then put it in a way that a clinician, how they're thinking. So they're thinking longitudinally about this treatment. They want to understand the stage of the cancer that the patient's in, and they need to see it all literally immediately. It's their command center.
Right.
And so what Ronin does is we take what's usually 30 to 40 minutes of hunting down to understand what has happened to this patient. Because again, you're weeks in between seeing a patient. So,
Sure.
and you see lots of patients. So imagine doing 30 to 40 minutes of hunting and
Trying to remember.
yes, and per patient, and you see 20 patients in a day.
Yep.
Versus one click of Ronin that's embedded in the EHR, so completely integrated. So you click one tab that says Ronin, whether you're Cerner or Epic, doesn't matter. And everything that you would spend 45 minutes, you can see it and digest it in less than 5.
Wow. That's so powerful.
And so now if you're the last patient of the day, whew, it's not, I mean, in fairness, in sitting and watching oncologists do their work, how exhausted they are by the end of the day, and you completely understand it. And in all honesty, there have been clinicians that literally have been brought to tears when they look at Ronin because they've said, I know I have missed some information on like biomarkers. If you've ever seen a biomarker report, it's a ton of information, and you are looking for that one value that is, you know, sort of like the needle in the haystack.
Right.
And this clinician saying, I know I missed that value, and this patient would have had a different outcome, was in palliative care, unfortunately. And so being brought to tears to say, if I had Ronin, I wouldn't have missed it because Ronin was going to bring that forward to me in this view where I need to see everything.
Sure.
And so, you know, that's obviously an unintended error, but that's also healthcare, and that's where we need technology to remove all of those unintended errors, because people are also people, human beings. So
Absolutely. Well, Kathy, this is incredibly insightful and exciting that, these solutions are coming to help these oncologists and doctors out there. So thanks for sharing. I really appreciate it. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, Kathy.
thank you, John.